Hey guys, and welcome back to my channel. So I haven't posted at all in April, but just an announcement. On April 1st, it was the 9-year anniversary of my first kidney transplant. Even though that first transplant failed, it did take a huge part in the fact that I am still alive and thriving today. So it is something that I still definitely celebrate. So I'm actually in Tennessee right now visiting family, and the sun is going down quick, so I'm gonna make sure I get through this video because I am gonna lose light here pretty soon. So today I wanted to talk about my medication regimen post-transplant. So the top of this year made it 17 months post-transplant. So this month I am 17 months post-transplant. And so my medication over time has tapered down, which means you start on a high dose or you start on a high quantity of medication. And then as your health increases, as your kidney function increases, they taper that medication down because you don't need it as much. Like for instance, my Prograf levels, I don't know what is going on with my eye up here. It's like twitching. I think I'm tired because I've just been on this different time zone. Yeah, your Prograf levels, which that's just your tacrolimus. So that's the medication that you're going to be on for the rest of your life. That and your CellCept. These are your immunosuppressants that keeps your body from fighting off your kidney that you've been transplanted. So they start with a high dose of that. They have to try to find a happy medium of where your body balances in taking that medication. And so currently I am on 2 1-milligram pills twice a day. No, actually, I'm on 1.5 milligrams twice a day. But initially, I think I was on 6 twice a day. So that's just an example of how they taper down your medication as your body function increases, as your health gets better post-transplant, and that body is actually getting used to that kidney being there, and your kidney and your body are working cohesively. So today I'm just going to go through the medications I'm on. I'm going to tell you a little bit about them so you'll know what to expect post-transplant, on what medications you'll be taking. Some people think it's a burden to be taking this medication every day for the rest of your life, but for me, I see it like 7 to 10 pills a day or having to do dialysis. Now, maybe that choice varies for people. Like maybe some people do prefer to be on dialysis over taking medication. Me, I choose the latter. I will choose taking medication for the rest of my life than dealing with the side effects of dialysis, or because my body may be in need of a transplant, my actual health feeling a lot less than what it was now. So yes, I will take up to 20 pills a day if that keeps me from ever having to do dialysis again. That is my choice for me and the quality of life and the way that I want to live my life. Some people don't want a transplant. They truly don't want to put their body through that surgery, and so they prefer to be on dialysis. It really is your choice. There is no wrong or right answer. And like I mentioned, I am in town because I wanted to visit my family, but what truly brought me to town was my update visit with my nephrologist at Vanderbilt. So that is the main reason that I'm here as well, which I love. I've decided, because I have moved to California, when it is time for my checkups with my nephrologist, I didn't want to get new care in California. I loved my physicians and my team here so much at Vanderbilt that I'm like, I will make the flight. Especially because I live in California, I don't get to see my parents often. For me, coming back to get that checkup with people who are very familiar with my health, and also getting to see the people that I love most in this world, for me, it makes sense. And like your medication, your visits are tapered out. So post-transplant, after you're released from the hospital, you come back to the hospital once a week. Then it extends to every 2 weeks. Then it extends to every month. Before this visit, I was coming back every 4 months. But because my visit went well, now they have decided to move me to every 6 months, which is an indicator that my body is doing extremely well. And believe me, I look through my numbers of my lab results very tediously to see what they're seeing. And at this point in my life, I am very understanding of what those numbers mean and how they can interpret my kidney function. So I am happy. I am blessed, to say the least. I did get a comment from someone saying that I don't answer all of the questions in the comment section. I do want to say that I am not a medical professional, so I really try to toe the line of telling my testimony and saying things and letting you know what's going on in my life to encourage you all who are going through what I'm going through. But because I do not want anybody following my specific care program or suggesting anything to you that might be detrimental, I do not answer comments that I feel like you would be better advised by a healthcare professional like your nurse or your nephrologist. I steer away from that because I don't want to put you guys in any sort of harm or the health of your body or your kidney function. I don't want to have any negative effect on that. Okay. You guys say hi to Chino. Okay, go lay down. So without further ado, let's get into the video. And make sure you don't forget to click. So this is the mycophenolate. This is one of your major anti-rejection medications. This one typically comes in a 500 milligram tablet. It's almost 99% for certain that you will be taking this medication for the rest of your life. This is your tacrolimus. This is the medication that I take. This is the generic version for Prograf, or the other way around. I have a 0.5 milligram tablet that I also take as well. I've known people to take 7 of these twice a day, and now I'm only taking 1.5. I hope to one day only be taking 1, but 1.5 is fine for me as well. This is another medication that most likely you will be taking for the rest of your life. Between this and the Cellcept, if there are 2 medications, I mean all of your medications you should never miss, but if there are 2 medications that you should absolutely never miss a dose of, it is your Cellcept and your Prograf. Omeprazole is also known as Prilosec. Prilosec is actually an over-the-counter medication that a lot of people take. So because of these medications that you are putting on your stomach every day, Prilosec is the first medication I take to just keep my stomach from being upset from these medications, just to kind of prep it to intake all of these medications. I will say that when I first started getting on this cocktail of medications, I did deal with some stomach ache. I've been dealing with stomach ache because of medications for a lot of years. You are on a variety of cocktails of medication when dealing with kidney disease, but I feel like the Prilosec has helped tremendously. I rarely deal with stomach ache, and if I do, it has nothing to do with my medication. Fluconazole is actually an antiviral medication. Now, because this is something that you have to be wary of, Cellcept and the Prograf. So your body is unable to fight off things as well as it could if you weren't on immunosuppressants. Fluconazole is a medication that a doctor will prescribe you just to be preventative of anything that may be entering your body. Without immunosuppressants, would absolutely be able to fight off. So atorvastatin is a medication that keeps your cholesterol down. Faulty kidney function typically comes with when your kidneys aren't working properly. Sometimes phosphorus builds up in your body, sometimes magnesium builds up in your body, sometimes potassium builds up in your body, and with the atorvastatin, sometimes cholesterol builds up in your body. The medication that we all know, especially when you deal with kidney disease, is the prednisone. Pre-transplant, a lot of patients are on a very high dose of prednisone. It's very difficult to deal with because there are some serious side effects to prednisone. I think the top one being for any CKD patient is the moon phase. I am still on prednisone, although a very low dose. I don't feel like my face has ever completely gone down. It's honestly hard to tell because since my body has got healthy, I have put on healthy weight. So sometimes that comes with, you know, a more rounding of the face. I am an adult woman and I have put on my grown woman weight, which I am so thankful for because pre-transplant, I had gotten down to 112 pounds. Like I said, I'm on such a small dose of medication. I'm happy with this. And for those of you who aren't aware of what prednisone is, it is a steroid that is widely used across a lot of actual illnesses. A lot of people take prednisone, a steroid, and yes, the biggest side effect is moon phase. So that is all the medication that I am on currently. Like I said, over time, these things can change, but I actually haven't had any medication change probably in the last 8 months. Everything has been stable where it's at. These medications that I'm on currently may be something that I'm on for a while. I don't know. Of all the medications that I showed you, all in all, I take this one twice, this one twice. I think, yeah, I take 10 pills a day. In exchange for dialysis and the way that I felt on dialysis, it's a no-brainer. And as always, if you have any questions or any concerns or any thoughts, please leave those comments below. I love when you guys engage under the videos. I hope you guys are well and in good spirits and you're still fighting. I love you. Thank you so much for watching, and I'll see you in my next video. Bye, guys. Scared me, Siri.